Hello and welcome to part 2 of the Coordinated Entry System training. This training is the second of 3 coordinated entry trainings designed to help housing provider staff, outreach workers, and other community stakeholders better understand how the coordinated entry system operates to best serve persons experiencing homelessness. This training is designed to more thoroughly cover topics related to coordinated entry and is aimed at housing providers, outreach workers, and other key coordinated entry stakeholders who will be working within the CE. The following topics this training will cover include coordinated entry system for singles, families, and veterans, housing program types, confidentiality agreements, assessment tools, housing first, the role of HMIS, and by name list meetings. Before diving into coordinated entry, this section of the training will review what types of housing providers or housing programs can be accessed through coordinated entry. There are 2 main types of COC-funded programs that clients can access through our COC. These programs are called Permanent Supportive Housing, or PSH, and Rapid Rehousing, or RRH. PSH programs provide housing and case management services to those that are highly vulnerable, particularly those experiencing chronic homelessness, and provides long-term rental assistance and supportive services. RRH programs provide short-term rental assistance and case management to help those capable of sustaining housing on their own reach self-sufficiency. VI-SPDAT assessment scores, which are discussed later in this training, that fall between a 4 to a 7 qualify a client for RRH, while clients who score 8 and above with a qualifying disability are eligible for PSH programs. When a single adult experiencing homelessness enters the coordinated entry system, there is a systematic process for how a client will navigate through the system. To first enter the coordinated entry system, a client will present at a service provider or outreach worker within the CES or the COC. The service provider or outreach worker will discuss with the client what resources they may currently have, such as a friend or family member they could stay with, to prevent the need for entering into the emergency shelter system or literal homelessness. This practice is not designed to deny access to shelters or housing programs, but to ensure before an assessment or referral is made that the individual has exhausted all other resources available to them. This is because entering into emergency shelter or literal homelessness is traumatic for many and limiting trauma while also saving limited resources for those most vulnerable is best practice. If a client is found to have no other resources available to them, the service provider or outreach worker will conduct the VI-SPDAT or a TAE VI-SPDAT if the person presenting is an unaccompanied youth between the ages of 18 to 24. Please note that youth may be couch surfing and staying unstably with friends or relatives, but they are still considered homeless if they are 18 to 24 due to their increased level of vulnerability. After the assessment, the provider or outreach worker will enter the individual in HMIS or give the assessment to CE lead agency staff to enter into HMIS. Persons who score a 4 and up will then be placed on the by name list based on their vulnerability score until a housing program spot is open. Once their number is reached on the by name list and a housing program spot is available, the client will be referred to housing. The Family's Coordinated Entry Access Point is designated as a single access point that is housed at the Metropolitan Interfaith Association, or MIFA. MIFA serves as the only Family's Coordinated Entry Access Point, and families must first present at MIFA and be experiencing literal homelessness to enter into CES. MIFA staff will provide mediation, a mandatory part of accessing the Family Coordinated Entry side, to discuss with families who are literally homeless what additional resources they may have available to them to prevent the need to enter into emergency shelter or continue experiencing literal homelessness. As with individuals, if a family has no other resources available to them, staff will conduct a family's VI-SPDAT assessment and refer the family to emergency shelter. While in emergency shelter, families are paired with a family housing specialist who will assist with pairing them with the correct housing program, either through permanent supportive housing or rapid rehousing, depending on the client's score and their need. Clients that qualify for rapid rehousing will receive housing search assistance from FHSs to ensure that they are able to find adequate housing in addition to receiving case management services. The process for veterans accessing coordinated entry is very similar to single adults and families. However, there are some veteran-specific resources to note. In addition to the individual's no wrong door approach access point for CE, single veterans who can also access coordinated entry through veteran-specific providers such as Veteran Affairs or the VA. After assessments are completed, veterans are placed on both the by name list and a veterans by name list for veteran-specific housing programs that are also available both through the COC and the larger community. This practice is HUD mandated and ensures that veterans are correctly assessed and prioritized for whatever housing resources, COC or otherwise, they may be eligible for. Veteran families are also able to access coordinated entry through the Family Coordinated Entry Access Point, as well as being able to access additional housing programs that are specifically targeted to veteran families, available both in the community and through the COC. HUD sets strict privacy standards for client data, and the COC is committed to ensuring that all sensitive client data is protected, especially when collected through assessments and for the purpose of housing. Before a client completes a vulnerability assessment with CE staff, clients must sign a release of information that allows their information to both be placed into HMIS and be utilized by COC providers for the purpose of getting them into housing. This includes documentation that is mandated by HUD to be completed prior to program entry, such as verification of homelessness and verification of disability documents when applicable. The next few slides will look in more depth at the assessment tools used within coordinated entry to measure vulnerability. This determines what programs clients qualify for, along with their place on the by name list for singles and youth. After assessments are completed, they are entered into HMIS in a client profile within 48 hours by those with HMIS access. If an assessment is completed by someone without HMIS access, the assessment needs to be faxed or emailed to CE lead agency staff as soon as possible. The Vulnerability Index Service Prioritization Decision Assistance Tool, or the VI-SPDAT, is used for measuring single adults' vulnerability over the age of 25. This assessment tool asks a variety of questions aimed at measuring physical, emotional, and mental vulnerability. Adults must be literally homeless to qualify for the assessment. For example, they must be living in a place not meant for human habitation or an emergency shelter. The Transitional Age Youth Vulnerability Index Service Prioritization Decision Assistance Tool, or the TAE-VI-SPDAT, is used for measuring single youth ages 18 to 24's vulnerability. This assessment tool is slightly modified from the single adult tool to better gauge areas of vulnerability common for youth. Youth who are 18 to 24 can be considered homeless if they are experiencing literal homelessness or if they are couch surfing or unstably housed. The Family Vulnerability Index Service Prioritization Decision Assistance Tool, or the Family VI-SPDAT, is used for assessing families with children. This assessment tool is modified from the single adults tool to include family-specific questioning. Families are considered homeless if they are experiencing literal homelessness, such as sleeping in a car, staying in a place not meant for human habitation, or staying in an emergency shelter. Families are also considered one adult with at least one minor child in the household. The following video is provided by OrgCode, the organization that created the VI-SPDAT assessment tools that are used within our community. This video is the training for administering VI assessments and must be watched in full in order to know how to correctly administer VIs.
Greetings. Welcome to this tutorial outlining how to do the Vulnerability Index Service Prioritization Decision Assistance Tool version 2 for single adults. My name is Ian DeYoung. I'm the president and CEO of OrgCode Consulting, and along with our fantastic partners at Community Solutions, it is my pleasure to run you through this short video on how to do VI-SPDAT version 2. We start by capturing administrative information. That would be the name of the assessor or interviewer and the agency or organization with which they work or are affiliated with. You also want to be capturing the date and time of the survey and the location where the survey is being completed. To ensure consistent results with the VI-SPDAT, it is critical that your community have a common opening script. This means that the VI-SPDAT is introduced the exact same way regardless of with whom the VI-SPDAT is being completed. In this opening script, you want to include such details as the name of the assessor and their affiliation, the purpose of why your community is using the VI-SPDAT. So for example, if you're using it for coordinated entry into services or prioritization, you should make that transparent. You want people to know that it usually takes 7 minutes or less to complete, that you are only seeking yes, no, or one-word answers. The participant must know that they are allowed to skip or refuse any question that they do not want to answer. You must indicate where the information will be stored. Also, that if the person does not understand a question, or that if you, as the surveyor, think that the question is not being understood, that you can and will provide clarification. Note, this may require you to get off script, but that is entirely appropriate if it is the difference between someone understanding a specific question and them not understanding the question. Finally, you want to provide an indication that honesty is being sought. Participants should know that they don't need to embellish a response nor keep information away from you in order to get access to a program, that you want them to answer as honestly and as openly as they feel comfortable doing. If you are completing the VI-SPDAT within your HMIS or other similar data system, it is quite likely you already have this information. The person's name and last name, as well as their nickname or any street aliases, the language they feel best able to express themselves, and their date of birth and age, as well as their social. If you don't already have this information and you're doing it on paper, you may be wondering why you have to ask for their age if you're getting their date of birth. The reason is they are likely to tell you their age faster and more accurately than you can do the math on their date of birth. This is important because the first possible score is a point of 1 for anybody who is 60 years of age or older. We then move into the first domain, history of housing and homelessness. There are 3 questions in this domain. Question 1, where do you sleep most frequently? You are then going to read through the answers on the right-hand side. Shelters, transitional housing, safe haven, outdoors, other, and if they indicate other, you want to specify on the line, or whether or not they've refused. If the person responds with anything other than shelter, transitional housing, or safe haven, provide a score of 1. If there's any confusion on what is meant by most frequently, you may want to ask them where they've slept most frequently over the past week or even the past month. Question 2 and 3 go together. Question 2, how long has it been since you've lived in permanent stable housing? This refers to housing that would provide rights of tenure. Permanent housing would not include such places as transitional housing or sober living facilities. You then want to ask, in the past 3 years, how many times have you been homeless? To increase the accuracy of recall, put the last 3 years in context. If I were conducting the survey, I would ask the question like this. In the past 3 years, okay, May 2015 until May 2014, May 2014 to May 2013, May 2013 to May 2012. Since May 2012, how many times have you been homeless? Don't forget to count the most recent or current experience of homelessness. If they've experienced 1 or more consecutive years of homelessness, or 4 or more episodes of homelessness in the last 3 years, then provide a score of 1. We then move into the domain of risks. This has a number of questions that relate to risk factors in the person's life that may impact their current vulnerability or their future housing stability. Starting with question 4, in the past 6 months. So let's increase accuracy of recall. Today is May 1st. So I would do this question by saying, all right, in the past 3 months, so from May 1st to April 1st, April 1st to March 1st, March 1st to February 1st, February 1st to January 1st, January 1st to December 1st, December 1st to November 1st. Since November 1st, how many times have you received health care at an emergency department or emergency room? Taken an ambulance to the hospital? Been hospitalized as an inpatient? Used a crisis service, including a sexual assault crisis, mental health crisis, family or intimate partner violence, distress centers, and suicide prevention hotlines. Talk to police because you witnessed a crime or the victim of a crime, or the alleged perpetrator of a crime, or because the police told you that you must move along. Stayed 1 or more nights in a holding cell, jail, or prison, whether that was a short-term stay like the drunk tank, a longer-term stay for a more serious offense, or anything in between. You count up the numbers from A through F, and if there's been 4 more interactions with emergency services, score 1. Questions 5 and 6 go together. Question 5, have you been attacked or beaten up since you've become homeless? Note that this only refers to the homeless period of time in their life. Question 6, have you threatened to or tried to harm yourself or anyone else in the last year? So threats may be verbal or written threats. Trying to harm yourself would include any attempts at harm, whether or not they were successful. Must also note that if a person has been involved in a physical altercation, even if they weren't the instigator of the altercation, if they did anything other than run away, chances are they've put the other person at risk. If it's yes to 5 or 6, score 1. Question 7, do you have any legal stuff going on right now that may result in you being locked up, having to pay fines, or that make it more difficult to rent a place to live? Legal stuff is a pretty inclusive phrase, intentionally so. But as such, there are times when sometimes people miss things. Legal stuff refers to any legal issue that would result in a payment of fine or incarceration, or that is going to make it difficult to find a place to live. That may include such things as being on a sex offender registry. It may include such things as moving violations and tickets from driving offenses. It may include court-ordered payments of fines. Anything that requires an involvement of a payment of fine or that would put someone at risk of incarceration counts as legal stuff. And if they say yes, score 1. Question 8 and 9 go together. 8, does anybody force or trick you to do things that you do not want to do? Now, force or trick means that it wasn't of their own decision making or not something that they've done and then later regretted, that they were coerced or duped or otherwise led to engage in behavior that they really didn't want to do. And question 9, do you ever do things that may be considered to be risky, like exchange sex for money, run drugs for someone, have unprotected sex with someone you don't know, share a needle, or anything like that? Did you note the cadence at the end of my voice when I asked that question? Or anything like that? It's deliberate. That's a device that you're actually indicating to the person that you read through a list and you don't want specifics. If they do happen to provide an overshare, this would be a good opportunity to make sure that they understand you only need a yes or no answer. Next up is the domain on socialization and daily functioning. Question 10 and 11 go together. 10, is there any person, past landlord, business, bookie, dealer, or government group like the IRS that thinks you owe them money? Note that it's whether or not they think they're owed money, not whether or not they agree with them. Question 11, do you get any money from the government, a pension, an inheritance, working under the table, a regular job, or anything like that? If they say yes to 10 or no to 11, then score 1 for money management. Question 12, do you have planned activities, other than just surviving, that make you feel happy and fulfilled? If they say no, score 1. Question 13, are you currently able to take care of basic needs like bathing, changing clothes, using a restroom, getting food and clean water, and other things like that? That is their own personal assessment of essentially their ability to exercise self-care and perform daily living skills. Question 14, is your current homelessness in any way caused by a relationship that broke down, an unhealthy or abusive relationship, or because family or friends caused you to become evicted? This is essentially asking them to draw a cause and effect of whether or not they see the current experience of homelessness as a result of those type of relationships or family encounters. If they say yes, score 1. The final domain is that of wellness. The first series of questions, 15 through 20, are all related to physical health. 15. Have you ever had to leave an apartment, shelter program, or other place you were staying because of your physical health? What this question is essentially getting at is whether or not their health has actually been compromised or so bad, or whether or not they've had a health condition that has resulted in them being unable to stay housed. It's their assessment of the situation. 16. Do you have any chronic health issues with your liver, kidneys, stomach, lungs, or heart? By chronic health issues, we are talking about very specific types of illnesses, and we are talking about specific parts of the body with this. Question 17. If there was space available in a program that specifically assists people that live with HIV or AIDS, would that be of interest to you? In this question, we are not asking the person if they have HIV or AIDS. We're asking them if they would be interested in a program that serves people with HIV or AIDS. 18. Do you have any physical disabilities that would limit the type of housing you could access, or would make it hard to live independently because you'd need help? There's no sub-assessment on those physical disabilities. It is their own personal assessment of those disabilities. 19. When you are sick or not feeling well, do you avoid getting help? And then if the respondent is biologically female, you want to ask the question, are you currently pregnant? If they say yes to any of the questions from 15 through 20, score 1 for physical health. Question 21 and 22 are the questions related to substance use. 21. Has your drinking or drug use led you to being kicked out of an apartment or program where you were staying in the past? 22. Will drinking or drug use make it difficult for you to stay housed or afford your housing? A quick note on 21. When we're saying in the past, we are actually talking about the more recent past. One might say the last 3 to 5 years. So for example, if they say I got kicked out of a place 25 years ago because of my drinking, but I've been sober for 18 years, that's not exactly the sort of time frame that we're looking at. If they say yes to 21 or 22, score 1. Question 23 and 24 are the questions we have related to mental health and cognitive functioning issues. 23. Have you ever had trouble maintaining your housing, or been kicked out of an apartment, shelter program, or other place you were staying because of a mental health issue or concern, a past head injury, a learning disability, developmental disability, or other impairment? Question 24. Do you have any mental health or brain issues that would make it hard for you to live independently because you'd need help? If they say yes to A, B, or C of 23, or to 24, score 1. Now, if you're using your HMIS or similar database, the next part happens behind the scenes. If you're doing it on paper, you'll have to check to see if they scored 1 in the physical health issues section, 1 in the substance use section, and 1 in the mental health section. Because if they scored 1 in all 3 of those, they're going to get an extra point here for trimorbidity. The last 3 questions. Are there any medications that a doctor said you should be taking that, for whatever reason, you are not taking? That could be because they can't afford it, or they've lost it, or it's been taken away from them. Doesn't matter the reason. Question 26. Are there any medications like painkillers that you don't take the way the doctor prescribed or where you sell the medication? If they say yes to either 25 or 26, score 1. And then question 27 is the question that is not written by us nor informed by people experiencing homelessness directly. It is written by experts in abuse and trauma and structured in this way to decrease the likelihood of re-traumatizing someone in the asking. Yes or no? Has your current period of homelessness been caused by an experience of emotional, physical, psychological, sexual, or other type of abuse, or by any other trauma you have experienced? If they say yes to that question, score 1 for abuse and trauma. Now on to the scoring summary. There's a 17 possible point total for the new VI-SPDAT. It is our recommendation that if they score 8 or more, that they be further assessed and considered for permanent supportive housing or an assertive community treatment or intensive case management housing first program. If they score between 4 and 7, we recommend that be assessed and considered for rapid rehousing. And if they score between 0 and 3, we are recommending that no housing support intervention be considered. Please keep in mind, the VI-SPDAT does not make decisions, it informs decisions. It provides data for you and your community to use in consideration of things like prioritization. As such, while it provides data, you're going to have to put the data in the context of how your community goes about doing assessments and how your community is going about doing prioritization. At the conclusion of that, there are some follow-up questions that many communities have found to be helpful. Like, on a regular day, where is it easiest to find you and what time of day is it easiest to do so? Is there a phone number and or email where someone can safely get in touch with you or leave a message? Okay, now I'd like to take your picture so that it's easier to find you and confirm your identity in the future. May I do so? You can add any other non-scored question that you want to the VI-SPDAT. That would be any question that's of interest to you or your community or would help with filtering or prioritization. And so long as you do not assign a point to it, ask away. That being said, only ask the questions that are going to be relevant for your community to make decisions and how to support people. Don't just ask questions for the sake of asking them. The sort of questions that are most commonly considered are things like military service and the nature of discharge, whether or not they've aged out of care when there's youth-specific programs, mobility issues when you need to know more about the type of housing that can be brought to bear or offered to people, legal status in the country. Some programs need to know income and source of it for specific types of housing, whether or not there's any current legal restrictions on where they're allowed to live or who they're allowed to live near, whether or not they're children that are not currently with the adult that are likely to rejoin the adult after they're housed. And many communities find it necessary and important to ask questions about safety. And this most often comes before the VI-SPDAT is even started as a pre-screen tool so that if someone would actually be better served through a domestic or intimate partner violence resource, that they do so. Some closing thoughts. You may be wondering, how do you convert the scores or compare the scores from version 1 to version 2? We put a resource up on org.co.
All COC programs are mandated by HUD to uphold Housing First in programming. Housing First is an evidence-based best practice that upholds that all persons are housing ready, and there should not be a barrier or any barriers to accessing housing, such as sobriety, mandatory mental health treatment, employment, and such. The principles of Housing First include immediate access to housing with no housing readiness conditions, consumer choice and self-determination, recovery orientation, individualized and person-driven supports, and social and community integration. Since there are often limited units open in housing programs, housing prioritization looks at a variety of factors to rank clients by most vulnerable. Our community has adopted prioritization standards set by HUD, which can be found in Section 1.4 of the Coordinated Entry Manual. Persons are prioritized based on a variety of criteria, including their VI-SPDAT score, length of time homeless, severe need, crisis utilization, other factors considered through case conferencing, such as vulnerability due to illness, victimization, or sex work, and subpopulations that are prioritized, including those fleeing domestic violence, youth 18 to 24, and veterans. HMIS, or the Homeless Management Information System, is utilized in multiple aspects of coordinated entry. When assessments are completed, providers or CE lead agency staff will input the assessments into HMIS, along with referring clients to the by name list within HMIS. This allows the CE lead agency to send referrals electronically, monitor the length of time between entry into coordinated entry and exits to housing, and generate a list of those currently active on the by name list. Having accurate and timely data allows our community to better understand our progress on system performance measures and understand what areas need improvement or additional resources to better serve persons experiencing homelessness. Documentation to verify homelessness and disability are needed for clients to qualify for various housing programs. Most notably, permanent supportive housing programs require both of these documents for a client to qualify for a housing spot, as clients must have a qualifying disability and be chronically homeless, unless no chronically homeless persons can be found within the COC. For rapid rehousing programs, clients do not need to have a documented disability, but must be able to document literal homelessness immediately prior to entering into the program. A verification of homelessness, or a VOH, must be completed to verify the length of time homeless or the status of a person's homelessness. Chronic VOHs must document at least 12 consecutive months of homelessness or 4 episodes of homelessness in the last 3 years, totaling 12 months. Verification of disability, or VOD forms, can be submitted as either a HUD disability verification form signed by a licensed medical professional or a copy of a current statement showing current SSI or SSDI benefits. An important part of the CE process takes place during the by name list meetings. By name list meetings are opportunities to bring housing providers, outreach workers, and COC stakeholders together in one room for discussions. They are a recap of what has recently happened in coordinated entry. This includes, but is not limited to, referrals to housing openings, reviews of clients that were removed or are pending removal from the by name list for inactivity, and any rehouse needs. They are focused on collaboration and communication to ensure that coordinated entry system is running efficiently, and they are facilitated by CE lead agency staff. With that, thank you for completing part 2 of the coordinated entry training. If you have any additional questions or concerns, please feel free to contact the CE lead agency staff at coordinatedentry@cac.org.